Speaking of kids, a lot is in the news right now about the measles outbreak. And Dr. Michael Green from the Division of Infectious Diseases at Children's Hospital of Pittsburgh is joining us right now. Good morning, Dr. Green. How are you?
Good morning. I'm doing well.
Well, thanks for hanging in there with us on the line. I wanted to ask you a few things, given the prevalence of this story in the news. What is the danger of getting your child vaccinated?
I personally don't know that there is a danger in getting your child vaccinated.
And what are the dangers of not?
So there are a number of infections that the current set of recommended vaccines are aimed at preventing. Certainly the one that's in the news today is measles. Measles used to be so common that essentially every child born in the United States would get an episode of measles by the time that they were 5 or 6. And worldwide, there's still many countries where the disease is highly prevalent and where it causes many episodes of infection, and essentially somewhere in the range of 1 in 1,000 children who are infected with measles may actually die from it. In the United States, the introduction of the measles vaccines during the mid to late 1960s really led to a dramatic decline in the number of cases of measles that we saw. This was actually so striking of an effect that in around 1990, the CDC declared that measles was gone in the United States. However, since that time, we still occasionally will see an episode of measles that will come from someone who has traveled out of the country or who has originated out of the country and comes in with a case of measles. During that same time period, there's been an increasing number of individuals who have chosen, for a variety of different reasons, to not vaccinate their children, which then creates a growing population of either not immunized or under-immunized individuals. And then if a case of measles is introduced, you can have spread, as this is an incredibly infectious agent, one of the most highly infectious agents that we're aware of. And so that brings us to our current time, where there was this episode in Disneyland in California, and there's been sort of ongoing cases originating from that event, and now involving 14 states and somewhere currently, I think, over 100 cases in the United States of measles.
Well, where did this anti-vaxxer movement come from? I mean, it seems to be based on, by all accounts that I've read, fabricated science.
So there was a paper, I think it was in the 1980s, that was published in The Lancet that tried to, or that did draw a link between receipt of the measles vaccine and autism. Subsequently, that paper has been reevaluated, and the data that were the basis of the paper have been proven to be flawed. The paper's actually been retracted. All of the co-authors of the primary author took their name off the paper, and the physician who was the primary author of the paper and the person behind the study actually lost his medical license. But since that time, there are still a lot of people who believe the association between the risk of measles vaccine leading to autism, although multiple efforts to reevaluate the science behind this and to look at it done in the Institute of Medicine, and I think there was a paper published even last year in the journal Pediatric that again showed that there's just absolutely no link between getting the measles vaccine and developing autism.
So, all right, at that point, you have to say to yourself, it's clear getting the vaccine, there's nothing that we know of scientifically that has any ill effects. But by not getting it, you're not only putting your child at risk, but other kids at risk as well.
Yeah, that's absolutely true, and in particular, there are some children who cannot get the vaccine. The most common reason might be is they're just simply too young to get the vaccine. But there's also a group of children that, for a variety of reasons, maybe they're being treated with cancer, or maybe they've had an organ transplant, or they might be born with an immune system that is not fully normal, and they cannot be vaccinated. And the scariest thing is that not only can they not be vaccinated, but because their immune systems aren't normal, they're at marked increased risk of actually experiencing a more severe infection.
Like a lot of the kids at Children's Hospital.
Well, yes, the kids at Children's Hospital, certainly a number of them would be at increased risk if they develop measles of having a more complicated course.
So if you get the immunization, you are still susceptible to it by, 10%?
So it's said that with the first dose of the measles vaccine, somewhere to like 2 to 4 weeks after you receive the dose of the vaccine, probably somewhere in the range of 90 to 95% of the children are protected. If you get the second dose of the vaccine, it's approximately 99% effective.
So, all right, there's a 1% chance. Okay, so how do you suppose that this proliferation of bad information will stop and seemingly well-meaning parents will stop doing the wrong thing?
You know, that's an incredibly difficult question to answer. I think it's a matter, from my own perspective, some of the reason why I think parents felt that they could make the decision to not vaccinate is that vaccines have been so successful that the illnesses that they prevent have become really quite common, or had become really quite common. But now, perhaps as these vaccine-preventable illnesses get into the news, it may make people think differently. You know, we're having the current measles outbreak today, and that's certainly drawing a lot of attention to the fact that children aren't vaccinated, all children aren't vaccinated for measles. Just a month or two ago, we had mumps in the news in Pittsburgh, and with the Pittsburgh Penguins, and concerns that they had been in at our hospital. And we have other issues, pertussis or whooping cough we see really on an annual basis all the time. And so maybe the increased awareness that these diseases, in fact, aren't completely gone and that they could come back at any time will help people to sort of rethink their decision-making, because while it might be easy to decide to not vaccinate your child if you thought they couldn't get measles anyhow, maybe it's a different thinking if you know that your child could get measles, and that it's actually, very difficult to even identify measles early on, to isolate those children, because in its first 2 to 3 or 4 days, it's a fever with a runny nose, cough, and red eyes. And how can you differentiate that from all the other viruses that are circulating in the community?
Dr. Michael Green from the Division of Infectious Diseases at Children's Hospital of Pittsburgh. Thanks so much for your time this morning. We greatly appreciate it.
Thanks for having me.